Among the many things we have learned throughout this crisis is that substantial progress towards the SDG in the aftermath of COVID-19 will depend on grounded alliances and transformative actions. The pandemic has brought to the surface not only the structural inequalities we face, but also the endless reservoir of care, commitment, and ingenuity of local governments and communities. They have been at the forefront in taking rapid and bold responses to this crisis. In most cases, they have done so without adequate resources, and at points even challenging indecisive, reluctant, and sometimes even authoritarian national authorities. Almost overnight, local governments and communities have mobilized all resources at hand and wide networks of in-kind support. Furthermore, we have witnessed great efforts to decommodify access to basic goods and services for all. This has happened through measures such as repurposing public buildings to provide shelter for the homeless, pausing evictions, introducing rent and service moratoriums, activating support lines to protect care workers, as well as women and children suffering domestic violence, building pop-up health facilities, food banks, and communal kitchens, among many other measures that have made a huge difference for many. Such local actions are not isolated measures, but have emerged at scale and across the urban world, in the hundreds of cities and towns where 95% of COVID-19 impacts have been mostly felt in more than 200 countries. We should not forget that all the enormous capacities displayed throughout the pandemic to do things differently, to protect lives and habitat rights to an extent that seemed to be impossible just a few months ago. The challenge now is to sustain and deepen the wave of local actions unleashed throughout the COVID-19 crisis. Is this about building back better? I would argue that we need more than that. We are not talking about bouncing back from a war or a devastating earthquake, but about bouncing forward from a health crisis that made evident the need to tackle long overdue challenges. The combination of public health crisis and economic paralysis has fallen hard upon the working and excluded minorities. We know that it will worsen poverty, joblessness, homelessness, hunger, and gender and race inequality. Now more than ever, we must oppose the traditional recipes of capital. Overcoming the crisis must not depend on financial flows in favor or under the control of private interests or speculators. In an interview in early April this year, the director of UNDP warned us that COVID-19 threatens to impose 2 decades of lost progress on many countries. Many regions across the world, and across the global south in particular, already know what it means to go through a lost decade. It is not just about turning the clock back 10 years, but about mortgaging the lives and opportunities of entire generations, risking further erosion of public and universal health, education, housing, services, employment, and social protection systems. Also in earlier April, and at a time in which the impact of the pandemic was only beginning to be felt in many regions, the UN Secretary General estimated the need to mobilize an international assistance plan equivalent to 10% or more of global GDP. Today, however, international and regional efforts on this front are still marginal, and they must be broadened and thought of as the equivalent of a localized Marshall Plan, not just for building back better, but for building forward transformative change. Local governments and communities are listening. They are closer than any other actor to the felt needs for change on the ground, but they also need to be listened to. They need to be resourced and empowered to craft, drive, and sustain a transformative and integrated agenda. They need the full backing of national governments and the international community to turn this critical moment into a historical turning point, to really move towards the ambition of leaving no one and no place behind. Such transformation can only be achieved under substantial distributed measures and a deep recognition of the value of the life of everyone, regardless of their class, gender, sexuality, race, ethnicity, religion, age, or physical and mental ability. Actions need to speak to the reality of the poor, informal workers, racialized groups, migrants and refugees, indigenous people, the more than 1 billion who live at risk of evictions, and to a large extent, the women who live at the intersection of these multiple social identities. Our obligation is not only the exercise of solidarity in times of crisis, but also the responsibility to push a different social and political conversation. Diversity, like difference, can no longer be synonymous with equality. We need new forms of redistribution, recognition, and parity in political participation in order to protect the collective construction of life, habitat, and dwelling. A safe place where we can all live in peace and dignity is possible. Let's join forces in calling for empowering local and regional governments, but also communities, to work closely together and to lead the journey. Thanks for listening.